Did you wake up this morning 2 pounds heavier than you were yesterday? And has this trend been going on for 2 weeks, 4 weeks, maybe a couple of months now? Well, I'm Dr. Mikulics, and today we're going to talk about what's going on behind this and to reassure you that you are not alone. So in my practice, I have women coming in with this concern and this complaint on a daily basis. And I have to say, in the earlier years of my career, I always thought, well, they probably have just fallen off the bandwagon a bit. They're eating too much. They're not exercising like they used to. But after seeing this trend for over 19 years, guess what? I'm thinking that there's something more to this. And I hate diets, so I really refrain from, putting my patients on specific diets. But I have recently found a really, really informative and good book called The Hormone Reset Diet. And I've read this a while back, and the things I like about this book is that Dr. Gottfried is a medical doctor. The book is well referenced by up-to-date studies in the current medical literature. And also, evenly importantly is it just makes good common sense. And the teaching in the book is in alignment with what I know about hormones and what I see in my practice and what I see to be true. So we will get started with a little overview of what the scope of the problem is. And so what starts to happen in majority of women sometime after age 35 is we reach this level of subtle estrogen dominance. And this is something, it may not show up on the labs, but it is as our ovaries start to slow down a little bit and maybe we're not ovulating as robustly, our fertility, although we're still fertile, it's not quite as robust, and progesterone levels start to decline. So you may or may not also be making too much estrogen, but just that relative shift of the progesterone lowering puts us at a little estrogen dominance. And this can lead to many of the metabolic problems that encourage weight gain because of the direct effect that estrogen has on our other metabolic hormones, particularly insulin. So you may have, no history of being diabetic and no issues with your blood sugar, yet that relationship, that interplay between the insulin and the estrogen in your body is one that is signaling your cells to go into preservation mode, storage mode, and keep the fat mode. So true, maybe you haven't changed anything. Maybe you're still eating your normal stuff you're eating. But this is how, even with no changes, your weight can start to increase. So there is good news. This plan really takes you through a gentle elimination of the foods that mess with your hormones. I also feel this is a great time of year to go through a change of eating plan. The seasons are changing and our bodies are ready for this. Also, this is a gentle elimination diet, and I feel pre-holiday time is a good time to implement this versus smack dab in the middle of December. So let's get into it. The Hormone Reset Diet deals with our 7 main hormones of metabolism. And those hormones are estrogen, testosterone, leptin, cortisol, thyroid, growth hormone, and insulin. So each of these are directly affecting, what is going on with our metabolism and how our body is processing our food and responding to our level of activity. So just to look at my notes quickly, This is a gentle elimination diet where every 3 days we'll be eliminating a food or a food group that may be contributing to a disruption in our hormone balance. And then at the end of the 21 days, we'll learn how to gently reintroduce certain things while monitoring the effect that they have on our bodies. So I like that approach in that, the elimination is temporary and we get to introduce it back, but in a controlled way so that you have control over the picture and over, whether or not something is well tolerated by you, is serving you well or not. Drinking water is going to be a huge part of this. We typically say, a couple liters a day, or at least half your body weight, current body weight, in ounces. And one thing I like to do is fill up, my containers in the morning, and then I maybe take one. You have one at home, one at work, but then you have a visual guide as to how well you're doing and just gauge where you're at with your water consumption in a day. In general, the things you will eat are going to be clean proteins, lots of veggies, certain fruits. And, sticking with that as your core foundation will take you very far in this plan. And then you do want to watch your net carbs. So that is something, it's a little simple calculation where you're looking at the total carbs of whatever item it is, that you are consuming, a potato or rice, and then you're subtracting the amount of fiber in that. So that's how you get your net carbs. Between 30 to a little less than 60 a day on that is a good goal. And then healthy fats. We want good fats, high quality extra virgin olive oil, ghee, coconut oil, those things with a higher smoke point that are not going to break down and turn into nasty, harmful fats when we're using them for cooking. So that's kind of an overall guideline on eating. And then the other components are exercise. And I also love that she includes, without really saying it, she includes an area on spirituality and checking in with oneself. So, and that can kind of go hand in hand with your exercise. Maybe one day you're feeling like getting that 30 minutes of cardio and going full strength, and another day maybe more of a yoga, more deep breathing. It's important to honor that, and that really helps in keeping our adrenals balanced and helping to regulate cortisol levels too, which is, as we'll see as we go through this, very important. So that is kind of your overview. It is an elimination diet. We're taking out a food group that adversely affects one of the metabolic hormones every 3 days. At the end of 21 days, we'll basically be eating vegetables, but that's okay because we're going to then reintroduce and see what suits us. The guidelines are lots of fruits and veggies, certain fruits, water, clean protein, watch the carbs, daily exercise. But again, yoga does count for this. And checking in with oneself, whether it be a journal, just time for reflection, all of those things are great. And one thing I'll say at the beginning too, is if we're doing one part where, maybe it's the initial, like where we're cutting out red meat, and you notice you have a significant weight loss, then that's going to trigger you that, hey, this is probably an issue for me. So that's going to be something when we're looking at re-entry, you're going to be really careful with that. Okay? All right, so that's the introduction. I will be back for chapter 1, our first reset, which is estrogen dominance. Okay.